Hi, everyone. I'm Steve Dellasan, and welcome to this week's editions of CEOs You Should Know. I am joined by Dr. Michael Skolnick, the CEO and founder of Abra Health. Michael, thanks for being here today.
Thanks for having me. Nice to meet you.
You too. Excited to dive in a little bit about yourself and more about the company. So why don't we kick it back to the first moment you decided you wanted to become an orthodontist?
Oh, man. All right. So I was 12 years old, and like most 12-year-olds, I was getting braces.
Same here.
And, I just remember really liking my orthodontist. He had a great little bubble he had built for himself. I remember he used to wear these like real snappy suspenders and nice ties, and he drove nice cars, and I was like, that guy is happy, got life figured out, and the team that he built around him was really positive, and that just always stuck with me. At that point, I didn't think I wanted to become an orthodontist, but it just left a big impression on me.
And how did that shape the journey from that moment on?
So, I have a little bit of ADD, maybe more than a little bit, and so deciding what to really focus on in my life was a major challenge, and I actually started college and I had no idea what I wanted to study. And it was my second year and I'd come home and it was time to pick a major. And I was really just struggling. And I was talking to my friends, talking to my parents about it. And, both my parents were in medical field. So I knew, that always attracted me. And a lot of the conversations at home were about science and healthcare. So I liked that field, but I had no idea what I wanted to do. And I was home from break, and all I really wanted was a car because there was a couple places around college that needed a car. And it was before Uber, and I'm driving with my mom, and we're talking about different things and majors. And I said, "Listen, Mom, I just want a car." And we happened to be driving past my old guitar teacher's place, and he has a yellow '57 Chevy parked out front. And I said, if you get me that car, I'll go to dental school. And I was completely joking with her. And she pulls over. And we start talking. She's like, are you serious? And I was like, yeah, but I was not serious. And we actually walk into this guy's place. And she asks him, how much is the car? And the car was shockingly inexpensive. It must not have been in the best shape. And she looks at me. She goes, so you'll go to dental school if I get you this car? And I said, at that point, I'm like really committed to this ridiculous thing I said. And I was like, yeah. So she buys the car. I have no idea how to drive stick shift.
Oh, my gosh.
Or how to take care of a car like that. But I had made this commitment. And it was very helpful because I had no idea what I wanted to do. And at least now I had like a commitment I had made. So I went back to school, signed up for pre-med, which was like the science courses to go to dental school, and started doing it. And so it started with that orthodontic experience, but then, that's how I ended up in dental school.
Thank you, Mom. What a great
Thanks, Mom,
to help you guide you, and it paid off. So starting Abra Health Group is a major endeavor. What motivated you and your wife, Dr. Brooke, to establish this multi-specific practice?
So, I met my wife in dental school, and, that was also a very pivotal moment, obviously, because, my wife, and we have now 3 kids together, but she gravitated towards pediatric dentistry. So it was natural evolution that we were going to open up something that was multi-specialty, because at least pediatric dentistry and orthodontics live really well together. Mm-hmm. And, at that point, we hadn't been married, but we were on that path and living together. So, that kind of opened my eyes to doing something in multi-specialty. But then at the same time, after I graduated, I had a bunch of different jobs. Some of them great, some of them terrible. And eventually, I kind of narrowed down to 2 places. One of them was in Manhattan, and the other one was in New Jersey, where we were living. And they both taught me so much and really different things. And from one of them in Manhattan, I learned a lot about scale. This was a massive office. It's still around. It's downtown. And it treated a lot of government insurance patients, which became a big focus for us. And that was the first time I saw, wow, that could really work, especially when you do it with a lot of volume. Mm-hmm. And the patients were appreciative. And, I was in charge of a pretty big group there. And it was the first time I had that experience. And, got a lot of positive feedback from the patients and from the staff. It just felt like we were making a difference. So that's where I got the idea and the bug to sort of do things in more underserved areas. And at the same time, I was working at a practice that was, kind of the total opposite end of the spectrum. It was a really high-end practice, didn't take a lot of insurances, was all focused on great customer service, and it was all about the culture. And that's where I saw how important culture was, because I'd never worked at a place where the staff was so positive, engaged, believed in the mission, and, really they pushed the practice more than the doctor. And it was incredible. And I was working at these two places, so I thought if someone put these two things together, it would just be dynamite. And we had already opened our office, and I started just learning and picking both of these guys' brains at the same time, and just started to incorporate a lot of that. And we focused a lot on the culture of the place, got the staff really involved, and worked out.
That's awesome. I completely agree. I think culture is one of the most important aspects of any organization. What would you say, building off of that? What's the mission and what's the culture of Abra?
To be really best in class with an integrated medical dental model, delivering high quality care to underserved communities. And our core values are really patient first, integrity, and teamwork, and having such a well-defined mission that everyone can get behind. And our core values just helps us make decisions, strategize, just kind of knowing the things that are really important to us.
That's awesome. And I know the concept was you and your wife kind of having these multi-specialty dental practices. How has that really helped you guys foster collaboration with maybe different dental providers? And how does it really benefit the patients?
So, in some of our larger practices, we might have 10 to 12 dentists there at the same time working, and even some physicians. And it allows, just naturally fosters collaboration, because cases often involve lots of different specialists. So they're in the same place, they're working together, and they're able to talk about different cases. And also, even individual dentists might be struggling and get second opinions. And, the other thing that also really helps is when you're working in the kind of environment we're working, which is a higher volume environment, and even lots of healthcare at this point is high volume. Having multiple providers takes away a lot of the stress, because if you get stuck, if you get backed up, you're able to have support from the rest of the team. So I think it helps with collaboration. It also helps with collaboration in terms of just managing, the patient flow.
Yeah, absolutely. Having multiple locations, I'm sure you have a large team, a lot of doctors, a lot of team members, and then hundreds of patients. How do you continue to allow Abra Health to have that patient-centric approach?
We actually have a fantastic team. Some of them are with me today. But we've got an unbelievable team. I'd say one of the best in the country. And, I'm very happy with them. And I guess the whole environment, is very collaborative in terms of the way we operate. And I think the way patient-centric becomes so critical is we all just focus on it. So everybody focuses on it. And that trickles down to kind of the regional managers and the managers. And they all know that whenever you face kind of a difficult situation or a difficult decision, that's the way we're going to answer it. So it kind of helps people just very quickly get to the answer, because it's like, what's best for the patient? And then the answer is usually pretty obvious.
That's awesome. I know you guys are currently expanding into multiple states right now, which is very exciting. What factors drove you to decide this expansion? And during the expansion, what challenges are you guys facing?
So, we've always been, excited about building new things, and we did a really great job of expanding and growing in New Jersey. And just from a business perspective, we decided at some point we'd have to kind of grow out. If we wanted to continue growing at the pace we were, New Jersey's only one state, we'd have to start to grow. So we kind of naturally looked at the contiguous states, just because, you could drive there and it's still easy to go visit frequently. So, we first looked at Pennsylvania, and now we're really looking at Connecticut. The challenges are really just different cultures. We're very close to New York, most of our practices, so I think we tend to have a very fast-paced, little bit aggressive approach when we are in meetings and when we're just trying to get things done. So So we've learned sometimes we have to tone that back a little bit as we get a little more into, say, rural Pennsylvania. But, those are just sort of more superficial differences. I think fundamentally, the values are the same and the approach to care is the same, but it's just, maybe a different approach to talking to people and slowing down a little bit.
Absolutely. Well, congrats on the expansion. As a leader in the dental community, how do you stay up to date on different industry trends and best practices that are out there?
So we do, I think that's become easier and easier with kind of the internet and just, belonging to different groups and for a bunch of years we attended these kind of group dental conferences and we made close connections with other groups. So I think collaborating with them and having discussions with them helped a lot. Us, in terms of a sounding board, also, hearing the same struggles, similar solutions. And I think just, reading, also having a lot of expert people on my team. So, I think once you start to differentiate, you've got lots of people kind of keeping up with their own facets of industries. I think that helps a lot.
Yeah, a lot of sharing, a lot of collaboration internally too. How do you handle any setbacks or failures for the organization? And what strategies have you implemented for yourself and other leaders at these different practices to be able to turn those around?
Yes. So, failures and setbacks are an everyday, fantastic part of business. And I think the important thing is to learn from them, be really transparent about it. I think even though as we get to be a bigger and bigger organization, we still try to work like a smaller one in terms of kind of maintaining the culture, being agile. And that comes along with a couple of missteps here and there. But I think if you are honest about it and, you kind of put your ego aside and you say, hey, that was a mistake. How do we kind of change course? And if you're not afraid to do that, I think other people around you sort of adopt the same approach. They're also not afraid to say, hey, I messed up. And I think that's really important because people mess up and that's okay. And you learn from it and you move on. But I think that's the most important thing is being able to turn it into a positive and just being able to openly say, yeah, that one was a bad move.
Yeah, absolutely. Speaking of learning, right? Throughout your journey, I'm sure you've learned a lot. If you were going to give some advice to someone brand new that wanted to explore the dental industry and hopefully eventually be able to open their own practice, what advice would you give?
Yeah, so that has happened a lot. We employ a lot of dentists and some of them will talk to me and say, hey, I want to open my own practice. And I always encourage them and I say, do exactly what I did, which is just work at a bunch of different spots and figure out, because it's tough to learn those things in school. You learn how to be a dentist, you learn how to take care of people, and hopefully you're an empathetic provider, but no one ever really teaches you the business side of things. And I say work in places and take the things you like, take the things you don't like, and do it. And don't be afraid to take some risks because you'll never do it if you don't.
Throughout it, I'm sure that there's your expansion into different states that you mentioned earlier. Are there any other exciting projects in the works that you want to share with the listeners?
We're very excited about some new technologies that we're implementing. One we've been working on for over a year, but it finally feels like it's getting to the point where we're going to be rolling it out everywhere. And that's sort of an AI tool that will read x-rays. So basically you take the x-rays and there's one version of them that kind of gives a whole bunch of findings on there. And then the doctor obviously is going to agree or disagree. But I think, that's exciting because one, it just, it's a real phenomenal use of AI, I think, because it prevents doctors from missing things.
Very cool.
It also level sets a lot, especially when you're working with groups of doctors. You always end up in situations where there might be different opinions. So having this objective sort of version helps them start conversations and feel a little more comfortable. That I think is going to be really revolutionary for the industry. And I think everyone will adopt that at some point because it would just be crazy not to. So I think now we're finally at a point where we're ready to implement it. And I think that's going to be a really exciting change. Anything else we're really excited about? We've integrated the medical groups inside the dental offices, which that, is pretty novel. And I don't know of any other groups that are doing that. So I think now that we're cohabitated everything, that's also very exciting.
That's awesome. Looking back at your journey at Abra Health, are there any key moments that stand out to you that were valuable life lessons that you'd want to share?
Like I said, I think you have to be really ready to take risks, take chances. I mean, there was many times where, I was ready to kind of close the office and walk away in the early days just because, when you are dealing with government payers, the negotiation and the struggle, it's very regulated, and there's also just, very few decision makers. And, when we first opened the offices, we weren't getting a lot of traction because we were new. And so I went and met with the two biggest payers in New Jersey at the time. And I walk into this first meeting, and I'm excited. We had already opened the office, and I said, hey, we opened up this office, and we could really use a little bit of help with some of the reimbursement rates. And the guy looked at me and he goes, get out of my office. And he threw me out. And I leave, and I go, oh, my God, I can't believe what just happened. Yeah. And I go home, and I'm talking to my wife, and I go, maybe we made a mistake. And, we just kind of decided, all right, we'll just keep chugging along. And I had another meeting with him, and I don't even think he remembered that first meeting because I kind of walked in there. I was like, hey, how's it going? And we had a much more positive result. So it was just to stay persistent. And, there was always a bunch of setbacks. And I think the message is just stay persistent and not give up.
Perseverance paid off.
Yeah.
So that's great to hear.
Yeah.
So we covered a lot. Is there anything that we did not cover that you'd love the listeners to know about Abra Health?
I guess I would just go back to the culture aspect of it. I think the real, the thing that's people are always very shocked about with Abra Health is we are a very large group and we have a very few locations. And those kinds of numbers and the kinds of growth we have at the individual locations is sort of unprecedented. And people hear those numbers, they just don't understand how it's possible to have such kind of large, successful practices. And for me, it's really been that culture of a staff-driven team where everyone's really engaged. And I think that's kind of been the secret sauce is just, having a clear mission and having a really engaged team that believes in it and it also feels like it's their business. And we do that through different incentives and just kind of always repeating that. And that's challenging. As you get bigger and bigger, it's hard to keep that. But I think that was really, especially in the beginning, what made it such a differentiator. It was a team that treated it like their business, and it grew really rapidly because of that.
Well, if anyone was tuning in and wants to find out more information of Abra Health, what is the first thing they should do?
Well, so if you go to abrahealthgroup.com, that's the website that kind of goes through myself and the different various members of the executive team. And then there's abradental.com and abrahealth.com, which are the two sites for our locations and actually patient-facing sites.
Awesome. Well, Michael, thank you so much for coming in. Thanks for telling us about your personal journey as well as all about Abra Health. We really appreciate it. And thank you to everybody for tuning in. Stay tuned next week for next week's edition of CEOs You Should Know.